Hi and welcome viewers of Nursing Academy 101. In this video we will talk about the challenging NCLEX RN and Prometric questions related to research, along with the answers and rationales part 1. But before we start, please, do not forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question 1. A nurse is participating in a research study that involves testing a new medication for managing pain in postoperative patients. The nurse has concerns about the potential side effects of the medication. Which ethical principle should the nurse consider before participating in the study? A. Justice. B. Non-maleficence. C. Beneficence. D. Autonomy. Answer. B. Non-maleficence. Rationale. Non-maleficence is the ethical principle that emphasizes the duty to do no harm to the research participants. In this scenario, the nurse is concerned about potential side effects, which aligns with the principle of non-maleficence. By considering this principle, the nurse ensures that the research study's risks are minimized and the participant's safety is prioritized. Question 2. A nurse is reviewing research articles to gather evidence on the effectiveness of a new wound dressing in promoting faster wound healing. Which type of research design is most likely to provide the strongest evidence? A. Case study. B. Randomized controlled trial, RCT. C. Descriptive survey. D. Cross-sectional study. Answer. B. Randomized controlled trial, RCT. Rationale. Randomized controlled trials, RCTs, are considered the gold standard in research designs for assessing the effectiveness of interventions. In an RCT, participants are randomly assigned to different groups, with one group receiving the intervention, new wound dressing, and the other group receiving a placebo or standard treatment. The randomization helps eliminate bias and confounding variables, providing stronger evidence of the intervention's impact on wound healing. Question 3. A nurse is reviewing a research article and notices that the p-value is 0.02. What does this p-value indicate? A. The study results are statistically significant. B. The study results are not statistically significant. C. The study results are inconclusive. D. The p-value cannot determine statistical significance. Answer. A. The study results are statistically significant. Rationale. In hypothesis testing, the p-value represents the probability of obtaining the observed results or more extreme results if the null hypothesis is true. A p-value of 0.02 indicates that there is a 2% chance of obtaining the study results by chance alone if the null hypothesis were true. Generally, if the p-value is less than the predetermined significance level, often set at 0.05, the results are considered statistically significant. In this case, the p-value of 0.02 is less than 0.05, so the study results are statistically significant. Question 4. A nurse is conducting a literature review and wants to ensure that the selected studies are of high quality and provide reliable evidence. Which of the following would be the most appropriate inclusion criterion? A. Studies published in the last 5 years. B. Studies conducted in a single healthcare setting. C. Studies with small sample sizes. D. Studies that underwent peer review process. Answer. D. Studies that underwent peer review process. Rationale. Peer review is a crucial process in research publication, where experts in the field critically evaluate the study's design, methodology, and findings before publication. Including studies that underwent peer review helps ensure their quality and reliability. Studies published in reputable journals that have undergone peer review are more likely to have robust methodologies and valid findings. Question 5. A nurse is involved in a qualitative research study exploring the experiences of caregivers taking care of family members with dementia. Which data collection method would be most appropriate for this study? A. Surveys with closed-ended questions. B. Observational checklist. C. Semi-structured interviews. D. Existing medical records review. Answer. C. Semi-structured interviews. Rationale. Semi-structured interviews are the most appropriate data collection method for qualitative research aimed at exploring experiences, perspectives, and emotions. Caregivers' experiences in taking care of family members with dementia are complex and multifaceted, making closed-ended survey questions or observational checklists inadequate for capturing the richness of their experiences. Semi-structured interviews allow for open-ended questions, allowing participants to share their stories and insights in depth, leading to a more comprehensive understanding of the caregiving experience. Question 6. A nurse is reviewing research articles on the topic of pain management in pediatric patients. Which research study design would be the most appropriate for investigating this topic? A. Cohort study. B. Case control study. C. Grounded theory study. D. Systematic review. Answer. C. Grounded theory study. Rationale. A grounded theory study is a qualitative research design used to develop theories or concepts from data collected through interviews, observations, or focus groups. For exploring the complexities of pain management in pediatric patients, a grounded theory study would be most appropriate as it allows the nurse to gain an in-depth understanding of the experiences and perspectives of both the children and their caregivers. Question 7. A nurse is conducting a research study on the effects of a new medication on blood pressure in elderly patients. What is the dependent variable in this study? A. Age of the patients. B. The new medication. C. Blood pressure. D. Elderly patients. Answer. C. Blood pressure. Rationale. The dependent variable is the outcome that the researcher measures or observes. In this study, the researcher is investigating the effects of the new medication, which is the independent variable, on the blood pressure of elderly patients. Therefore, blood pressure is the dependent variable. Question 8. A nurse is critiquing a research article and notices that the confidence interval, CI, for the study's primary outcome is very wide. What does this wide CI indicate? A. The study has a large sample size. B. The study results are not statistically significant. C. The study results are precise and reliable. D. The study results are not precise and need further investigation. Answer. D. The study results are not precise and need further investigation. Rationale. A wide confidence interval, CI, indicates that the estimate of the study's effect size is not precise. It suggests that the sample size may be too small to provide a reliable and accurate estimate of the effect being measured. In such cases, the study results may not be statistically significant, and further investigation with a larger sample size is needed to draw more reliable conclusions. Question 9. A nurse is conducting a research study and wants to ensure that participants' identities remain confidential. What is the best approach to achieve this? A. Obtaining informed consent from participants. B. Assigning a unique identification number to each participant. C. Using a double-blind study design. D. Randomly selecting participants from a larger population. Answer. B. Assigning a unique identification number to each participant. Rationale. To maintain participants' confidentiality, assigning a unique identification number to each participant is the best approach. This method allows the researcher to collect data without directly linking it to individuals' identities. It ensures that the data can be analyzed and reported anonymously, protecting participants' privacy and complying with ethical research standards. Question 10. A nurse is reviewing a research article and notices that the study's results have a p-value of 0.07. What does this p-value indicate? A. The study results are statistically significant. B. The study results are not statistically significant. C. the study results are inconclusive. D. The p-value cannot determine statistical significance. Answer. B. The study results are not statistically significant. Rationale. The p-value represents the probability of obtaining the observed results or more extreme results if the null hypothesis is true. A p-value of 0.07 indicates that there is a 7% chance of obtaining the study results by chance alone if the null hypothesis were true. Generally, if the p-value is greater than the predetermined significance level, often set at 0.05, the results are not considered statistically significant. In this case, the p-value of 0.07 is greater than 0.05. So the study results are not statistically significant. Question 11. A nurse is conducting a research study comparing the effectiveness of two different wound dressings in promoting wound healing. Which type of research design would be most appropriate for this study? A. Qualitative phenomenological study. B. Experimental study. C. Longitudinal study. D. Descriptive correlational study. Answer. B. Experimental study. Rationale. An experimental study is the most appropriate research design for comparing the effectiveness of two interventions, such as wound dressings. In an experimental study, participants are randomly assigned to different groups, with one group receiving one wound dressing and the other group receiving the other dressing. The researcher then measures wound healing outcomes to determine the effectiveness of each intervention. This design allows for control over confounding variables and strengthens the ability to draw cause and effect relationships. Question 12. A nurse is reviewing a research article and finds that the study's results support the research hypothesis. What does this imply about the null hypothesis? A. The null hypothesis is accepted. B. The null hypothesis is rejected. C. The null hypothesis is proven correct. D. The null hypothesis is irrelevant. Answer. B. The null hypothesis is rejected. Rationale. In hypothesis testing, the research hypothesis, alternative hypothesis, is the hypothesis the researcher is trying to support, and the null hypothesis is the opposite or default hypothesis. When the study results support the research hypothesis, it means that the null hypothesis is rejected. However, it's important to note that hypothesis testing does not prove hypotheses but provides evidence for or against them. Question 13. A nurse is conducting a survey to assess nurses' attitudes towards pain management practices. What type of data will be collected through this survey? A. Qualitative data. B. Quantitative data. C. Mixed method data. D. Meta-analysis data. Answer. B. Quantitative data. Rationale. Quantitative data involves the collection of numerical data that can be measured and analyzed statistically. In this survey, the nurse is assessing nurses' attitudes, which can be quantified on a scale, example Likert scale, or converted to numerical values. The responses will be analyzed using statistical methods to draw conclusions about nurses' attitudes towards pain management practices. Question 14. A nurse is conducting a systematic review on the effectiveness of various non-pharmacological interventions for reducing anxiety in surgical patients. What is the primary goal of a systematic review? A. To identify gaps in the literature. B. To summarize the findings of a single study. C. To provide recommendations for clinical practice. D. To compare qualitative and quantitative research methods. Answer. C. To provide recommendations for clinical practice. Rationale. The primary goal of a systematic review is to synthesize the results of multiple research studies on a specific topic to provide evidence-based recommendations for clinical practice. By pooling the findings of numerous studies, systematic reviews can offer more robust and reliable conclusions compared to individual studies. They help healthcare professionals make informed decisions about patient care based on the best available evidence. Question 15. A nurse is participating in a research study that involves human subjects. Which ethical principle ensures that the participants have the right to withdraw from the study at any time without penalty? A. Justice. B. Beneficence. C. Autonomy. D. Informed consent. Answer. C. Autonomy. Rationale. Autonomy is the ethical principle that upholds individuals' right to make their own decisions and have control over their bodies and actions. In a research study involving human subjects, obtaining informed consent is a crucial aspect of respecting autonomy. Informed consent ensures that participants are provided with all relevant information about the study, including the right to withdraw at any time without facing any negative consequences or penalties. Question 16. A nurse is conducting a research study to investigate the relationship between physical activity levels and blood pressure in adults over the age of 50. Which research design would be most appropriate for this study? A. Quasi-experimental study. B. Cross-sectional study. C. Case-control study. D. Cohort study. Answer. D. Cohort study. Rationale. A cohort study is the most appropriate research design for investigating the relationship between exposures, physical activity levels, and outcomes, blood pressure, over time. In a cohort study, a group of participants is followed over a specified period, and their exposure to risk factors, physical activity levels, and outcomes, blood pressure, are measured and compared. This design allows for the examination of cause and effect relationships over an extended period. Question 17. A nurse is reviewing a research article and finds that the p-value is 0.001. What does this p-value indicate? A. The study results are not statistically significant. B. The study results are statistically significant. C. The study results are inconclusive. D. The p-value cannot determine statistical significance. Answer. B. The study results are statistically significant. Rationale. The p-value represents the probability of obtaining the observed results or more extreme results if the null hypothesis is true. A p-value of 0.001 indicates that there is a 0.1% chance of obtaining the study results by chance alone if the null hypothesis were true. Generally, if the p-value is less than the predetermined significance level, often set at 0.05, the results are considered statistically significant. In this case, the p-value of 0.001 is much less than 0.05, so the study results are statistically significant. Question 18. A nurse is conducting a research study and wants to ensure the results are generalizable to the entire population. What is the most critical factor for achieving generalizability? A. Large sample size. B. Random sampling. C. Convenience sampling. D. Convenience sampling. Answer. B. Random sampling. Rationale. Random sampling is the most critical factor for achieving generalizability in a research study. In random sampling, every individual in the target population has an equal chance of being selected to participate in the study. This ensures that the sample is representative of the entire population, increasing the likelihood that the study's findings can be generalized to the larger population. Question 19. A nurse is participating in a research study that involves human subjects. The study aims to test a new surgical technique. Which institutional review board, IRB, function is the primary concern in this study? A. Determining the sample size. B. Monitoring participant safety. C. Data analysis and interpretation. D. Writing the research protocol. Answer. B. Monitoring participant safety. Rationale. The primary concern of the Institutional Review Board, IRB, in a research study involving human subjects is ensuring participant safety. The IRB reviews the research protocol to assess potential risks to participants and the measures in place to protect their welfare. Throughout the study, the IRB monitors the ongoing safety of the participants and may make recommendations or modifications to the study to safeguard the participants' well-being. Question 20. A nurse is conducting a qualitative research study to explore the experiences of patients with chronic pain. What is the primary method of data collection for this study? A. Surveys with open-ended questions. B. Laboratory-based experiments. C. Observational checklists. D. In-depth interviews. Answer. D. In-depth interviews. Rationale. In-depth interviews are the primary method of data collection for qualitative research studies aiming to explore participants' experiences, perspectives, and feelings. Through interviews, the nurse can elicit detailed narratives from patients with chronic pain, allowing for a comprehensive understanding of their unique experiences and insights. This qualitative data collection method enables the researcher to capture the complexity and richness of the participants' experiences. Question 21. A nurse is reviewing a research article and finds that the study's confidence interval for the mean systolic blood pressure is 120 plus or minus 5 mm of mercury. What does this confidence interval indicate? A. The study results are precise and reliable. B. The study results are not statistically significant. C. The study results are within the normal range. D. The study results are inconclusive. Answer. A. The study results are precise and reliable. Rationale. A confidence interval, CI, provides a range of values within which the true population parameter is likely to lie. In this case, the CI for the mean systolic blood pressure is 120 plus or minus 5 mm of mercury, which means that the true mean systolic blood pressure for the population is likely to be between 115 mm of mercury and 125 mm of mercury. The narrow range of the CI, plus or minus 5 mm of mercury, indicates that the study results are precise and reliable, providing a relatively accurate estimate of the population parameter. Question 22. A nurse is conducting a qualitative research study exploring the impact of a new palliative care program on end-of-life experiences in cancer patients. Which data analysis approach would be most appropriate for this study? A. Descriptive statistics. B. Inferential statistics. C. Content analysis. D. Regression analysis. Answer. C. Content analysis. Rationale. Content analysis is the most appropriate data analysis approach for qualitative research studies that aim to explore textual or narrative data. In this study, the nurse is examining qualitative data obtained from interviews or written accounts of patients' experiences. Content analysis involves systematically categorizing and interpreting the content to identify themes, patterns, and meanings within the data, allowing for a deeper understanding of the impact of the palliative care program on end-of-life experiences. Question 23. A nurse is reviewing a research article and finds that the study used a convenience sampling method. What does this sampling method imply about the study's results? A. The study results are highly generalizable. B. The study results are biased and not representative of the population. C. The study results are derived from a randomized sample. D. The study results are reliable and valid. Answer. B. The study results are biased and not representative of the population. Rationale. Convenience sampling is a non-probability sampling method where researchers select participants based on their easy accessibility or availability. This sampling method often results in a biased sample that may not accurately represent the entire population of interest. Therefore, the study results may lack generalizability, as they are limited to the characteristics of the individuals who were easily accessible for participation. Question 24. A nurse is conducting a research study to investigate the relationship between stress levels and sleep quality in healthcare workers. Which type of research design would be most appropriate for this study? A. Case series. B. Cross-sectional study. C. Longitudinal study. D. Meta-analysis. Answer. C. Longitudinal study. Rationale. A longitudinal study is the most appropriate research design for investigating the relationship between stress levels and sleep quality over time in healthcare workers. In a longitudinal study, data is collected from the same group of participants at multiple time points, allowing for the examination of changes or associations over time. This design is ideal for understanding the potential cause and effect relationship between stress levels and sleep quality among healthcare workers over an extended period. Question 25. A nurse is conducting a research study and finds that the results show no statistically significant difference between two treatment groups. What does this result suggest? A. The treatments are equally effective. B. The sample size was too small to detect a difference. C. The research design was flawed. D. The study is inconclusive. Answer. B. The sample size was too small to detect a difference. Rationale. When the results show no statistically significant difference between two treatment groups, it suggests that the study may not have had enough power to detect a difference, possibly due to a small sample size. A larger sample size is needed to increase the study's power and enhance the chances of detecting meaningful differences between the groups. This highlights the importance of adequately powering research studies to avoid type 2 errors, false negatives.